Welcome back to the Care and Conversation studio. Me and my team have had our lunch, so we've got full tummies, nothing in our teeth, I hope, and we're ready for like a load of interviews this afternoon. No breaks either. I've got just back to back all afternoon, so I'm hardcoring it from 1 until 5, and then we're done for the day. But so we have James in the studio with us. Hi, James. How are you doing?
Yeah, very good, thank you. James Maynard, Marketing Director of the Access Group.
Perfect. So what does that mean? What do you do? Yeah, tell us a little bit about it.
I look after health, support and care from a perspective, and it's really about understanding the challenges we've got with health, social care, and
Oh, sorry, your mic's not on. There you go. Perfect. So,
Are we there?
yeah, okay. We'll roll again.
We'll roll again.
It's fine, yeah. Things go wrong when you're live. It's all good. So, James, tell us who you are and what you do.
So, Product Marketing Director at the Access Group. And that really involves engaging across our health support and care division, which is both our health sector, local government and care. And it's about how we bring those things together and have a consistent view. But really, my passion is technology. Very much focused into the care sector, but 25 years in technology. So it's about how do we use innovations, technologies to drive those kind of marginal gains and efficiency and benefits into the sector.
Perfect. So we were chatting before we went live about technology and all things, and talking about how amorphous it can all feel and how kind of unobtainable, ununderstandable it is. But when you boil it down on a human level, what for technology, what's it about for you? Like, how does that articulate itself for you? And sort of,
I think it's a real challenge, and I think nobody is going to turn around and say they don't have an ambition to use that latest technology. I think the challenge we all have is that ability to turn that level of ambition into action. How do I go about using it, and what benefit is it really going to bring? And I think that's where we really need to think about those small elements. What is the biggest challenge I've got, and is the technology available that will allow us to address that? And I think we see constant change, constant evolution of technology, but think about it at a really personal level. Like, what is it I need to address? And in most cases, technology exists. It's just how do we apply it in the right way?
So how do we apply it? So obviously we talked about you've got you work for an organisation that has a wide range of different technologies and softwares, and that idea that they're, now more than ever, they're connected. The finance part is connected to the rostering, to the care planning, to the how do we complete that circle? Because we're not quite there yet, are we? There's still work to do.
Yeah, I think we're fortunate to be in a position where we can have a common format that which all of those products sit on. And historically, it's been about how do I surface a level of insight and value from that data that's hosted within those products and services. It's about thinking about what solution am I trying to address, and it's about how do I interact with it. I think that's the biggest thing, is that actually, do I need to have a data scientist in order to pull out that value of data? Do I need to have BI experts in order to create those dashboards? That's no longer the case. And I think through the power of having AI, or for us it's an Evo platform, you have the ability to interact with those services in a far more human way. So we talk very much about our policies and procedures. Policies and procedures, probably one of the most boring topics. And actually it's just a checkbox exercise in most instances when you think about it. But actually, from a policies perspective, hugely valuable to protect an individual, protect those you're looking after. So being able to just ask in natural language, how do I lift someone safely, or how do I accept a gift? And it going into your policies repository, pulling and surfacing that information, you then say to it, actually, any chance you could give me that in Romanian? It translates it into Romanian. You can digest that immediately from your mobile app. All of a sudden, you're not only delivering a greater level of compliance, but you integrate that with your learning management platform, and it surfaces then that learning for you to do afterwards. So you're helping look after people better, higher quality of care. You're giving them greater confidence because they know they're doing the right thing. You're not phoning into a care office asking them to surface that information for you. And you can promote greater levels of learning and understanding through what is a very typically boring subject.
Yeah. So I guess, break it down even more, did you say, how can I accept a gift?
Yeah,
Was
for
one- yeah.
example.
Okay, so you ask your company's AI or the AI they use, and then that references the policy. So what you're doing there, in essence, is rather than going, okay, this is the question I have, so which policy do I need? Okay, I'm going to go to the policy folder, I'm going to click in, I'm going to look for that policy, I'm going to open that policy. God forbid it's not a 25 megabyte Word document that takes a minute to open. And then I'm going to read through it and try and identify and articulate, because it might not be written in plain English. It's probably not written in plain English, is it really? No. Okay, how do I interpret that? Whereas actually, if you take that process, and that might only be 2 or 3 minutes, but if you can break that right down into that simple question, and you can use, yeah.
And I think that's just one marginal gain. And I think if you then begin to apply that same thing to say, okay, how do I add that capability into my care planning? So integration of things like AI smart notes. Just rather than going back and writing those care assessment forms, just talk into your mobile device and it directly map all of those elements into your forms, which is what we have in Access Care Planning. So that then all of a sudden removes that requirement to do that, and also has the ability to recognise voices. So if you need to demonstrate the individual you're looking after their opinion, actually you can, with their consent, just record, and it will pull out and filter both of those things. At the back of that, you need to write a note to the family member and say, on the recent visit, just ask it to write a letter to Mary, and it will format it in the right way with all the key outcomes that were taken part of that conversation, and send that letter to Mary. So all of a sudden you're seeing real benefits. Again, marginal each time, but a 40% saving in writing up care notes is not necessarily marginal, it's probably fairly fundamental. But there are these marginal gains all the time, and there where we begin to see the value coming through.
So you mentioned that the work you're doing with the NHS and saving like time on notes. How does that actually work then? To break it down to talk about can you talk about a trust?
Yeah, so I mean, I think if we're running quite a few of the smart notes, or we have similar products, but smart notes, which is basically doing the same thing, which is about how do you update patient records. I always like, to be honest, one of the demonstrators I like best is actually a social worker, because it's the ability to take. So as part of the interaction, you're recording that conversation, you've predefined the template that you would need to send in to various places, so whether that into the mental health or etc. And it defines and puts all of that information from that recorded conversation from whoever is in the room, but actually one of the individuals in the room at the time was the lady's son. And you have the ability for it to then produce that letter for the lady's son in a language that a 10-year-old will understand. So it will say, Mummy's going to feel a little bit tired mid-afternoon most days. It's all right, just support her and look after her. She's doing really well. Don't forget to make sure she takes that pill in the evening. Just give her a little reminder. But it can write it in a way that's... And you're then beginning to engage on a far more personal level. But technology's supporting and complementing that, and I think that's, for me, is the key thing, is tech being complementary to the individual delivering that care, that service, and helping enhance what they do.
And making those notes, I guess, more human in a way, so I suppose there's medical notes, and then there's, notes where you're communicating with someone, over time, they're not there when you need to tell them something, so you're telling them something for later.
And also readable. So if we take one without anything else, how an individual writes those notes up, depending on what's necessarily their first language, the tone of voice that they're perhaps using, the phraseology they use for some of the things they've heard. If you're trying to look at those notes at a secondary glance, actually that can become quite difficult, or write those notes up on behalf of somebody else. It's being able to actually understand everything that's there. So removing that element of human error, if you like, and having it in a very consistent way, it adds massive benefit and efficiency.
And then, obviously, working with local authorities, what are they using this stuff for? How are they using it to kind of make efficiencies? And
so we tend to see it in social care more than anything. But for us, the Evo AI piece is about how that level of integration. So how do I take technology-enabled care within a care environment, feed into the social care mosaic systems, for example? How do I take that and feed it into a digital EPR, kind of our Rio Health EPR system? Or how do I filter that data into the care planning solution? That then begins to give you that greater insight. So all of a sudden you've got connectivity across those three core areas, which is key. But equally, looking at things like overnight care. If you're using tech, how does tech support increasing the amount that you can support overnight? Does it tailor the way in which you use a district nurse versus a carer, because you have greater insight of that particular individual, and you can only get that by feeding that data back into other systems and that level of integration to say, as a carer walking up the pathway, I know that York got up at 5 times during the night and used the bathroom. Probably ought to check hydration levels.
It's those 2 pints I had before I went to bed, wasn't
Always
it?
the way.
Okay, well, so it's really interesting to sort of, and I think that's the thing that we have to do as a sector, is try to help people understand what this technology stuff means and what this AI stuff means to them. You know, what change that can make, and you know, each person involved in care has a different objective. Like the owner's objective is going to be different, but everybody is trying to just deliver better care, right, overall. And you know, if we can do that more efficiently and make it easier and more enjoyable for people, I think that's a good thing, right? Yeah,
and I think it's less about being purely technology providers. It's about technology partnerships, because you need the sectors, whether it's this sector or another, all need to work collaboratively together, and it's about the partnership between you and the provider of that care. We're the technology experts as tech providers, so let us partnership and help you understand where those benefits and gains can come from.
Perfect. Right, well, thank you very much for coming to the studio. It's been good to see you, and we'll be back shortly with another interview.